standard precautions are in place. We're going to assemble and apply high flow oxygen to this patient, and then we're next going to check the patient's vital signs. Okay, sir, close your eyes for me, please. I'm going to open them one at a time and shine a bright light in your eyes. Just look straight forward for me. I'm going to check the core temperature, and the skin in this patient is cool and moist. So I'm next going to call and get a physician's order to administer some type of medication. EMTs are trained in intramuscular injection as response to potential chemical warfare actions taken by hostile parties. So you're probably not going to know what type of medication you'll be administering until you finally get that physician's order. Once you do have the order, assemble the medication. Now obviously we're going to check the 5 rights as to that medication, right medication, concentration, dose, so on and so forth. We're going to need an IM syringe. This is a 3 cc syringe, and it is not the same thing as the tuberculin syringe that you use for the epinephrine injection. We're also going to need alcohol preps and Band-Aids. Okay, so once we've checked the medication and we have all of our 5 rights down, the next step is to get an alcohol prep. We're going to cleanse the stopper on the vial. We're going to uncover our syringe, and we're going to pull the dosage of medication that we're supposed to give in air, plus at least another couple of tenths of a cc. You then inject the needle straight down into the vial, push your air, invert it, and you want to withdraw the amount of medication that you injected plus an additional couple of tenths or so. Okay, once you have that pulled up, hold it upright to get the air bubbles to the top, and simply squeeze the medication out until you're to the correct dose with no additional air bubbles. Okay, after we've done that, we're going to explain to the patient what we're going to do. Sir, we're going to give you an intramuscular injection into your arm. It's going to hurt just a little bit, but this is necessary to make you feel better. And we're going to select the site, which is always injected into the deltoid muscle. The way to find the proper place in the deltoid muscle is to first find the acromion process, which is the bony knob here at the top of the shoulder. Once you find that, you're going to come a couple of finger widths below that. You next want to find the axillary crease, which is the fold where the arm and the torso meets, and draw an imaginary line around the arm at that point. And we're going to come roughly 2 finger widths above that line. You want to imaginarily divide the arm or the shoulder into 3 boxes, and you're going to start looking to the center box. So roughly this is the point that I'm going to inject my medication. I've selected my site, so I'm going to take an alcohol prep. I'm going to swab in a spiral motion outward from the point that I want to inject. Let that air dry. Don't fan it, don't blow on it or anything. Once it's air dry, I'm going to uncover my syringe. Holding it at a 90-degree angle, I'm going to spread the skin apart, and I'm going to stab in a swift motion into the arm. You then aspirate to see if you have a blood return. If there is a blood return, you simply withdraw the syringe, discard it, and start over. If there is no blood return, slowly inject your medication. Take your alcohol prep, cover the site, withdraw at the same angle that you inserted it, place it into a sharps container without recapping it, massage the area gently, and then we're going to apply a Band-Aid over the injection site.